Hi, I'm Dr. Max Gomez at the Fifth International Vatican Conference, and it is my pleasure to say hello to someone I've not known personally, and followed for a long time, Dr. Paul Farmer. Paul, thank you for joining us today.
Thank you, Max. It's great to be here.
Likewise. So let me start out with, as I'm sure you know, many of the scientific conferences that we all go to tend to be pretty narrowly focused, siloed even. What do you feel is the value of such a broad-based conference like this Vatican conference?
Well, I mean, the reason I'm excited about it is precisely because it can't be narrow. Human experience, lived experience in health and illness is, of course, not unidimensional. So this narrowing, which came about in medicine, as you know, Max, and led to powerful new discoveries, the narrow focus on a problem, a mechanism even, a protein, all the way down to an atom. And the yield on that has been great, but the cost of that kind of dissociative parsing has been significant. So, you expect if something is, it is the Vatican after all. I know that it is going to contemplate a very much broader range of considerations when we think of even the most specific problem, like how do we best vaccinate people against COVID-19, or the broader question of building equitable health systems. So that's the beauty of it.
So you alluded to it, and I think most medical and scientific type folks would agree that we're kind of in a golden age of science and research now. The advances are breathtaking. But as you said, the cost is escalating. How do we make sure that these advances don't just go to the wealthy, or keep that class of people healthier, and we leave a whole lot of people behind?
Well, this is yet another reason, and maybe the main one, to call for an equity focus from the very beginning of any endeavor or any response to a new problem like COVID. I can say, and I'm sure, Max, that you saw the same thing, that a lot of folks did call for an equity focus from the outset. And many pursued that, meaning, how can we get to the most vulnerable? Now, I don't think, certainly an American would not say we have fared well in responding to COVID. In fact, we've done uniquely poorly, as is well known, but not on every front. For example, the investments that the NIH and other funders made in developing new platforms that would help the most vulnerable has yielded these vaccines really rapidly. And so I hasten to add that we haven't messed up on everything, but if we had had an equity focus from the outset that we could expect to be rolled out across a very diverse group of states in the United States and different administrative districts, we know we would have had less transmission and less death. And I think there are other places like Rwanda where we can learn a lot of lessons about how they did it and prevented a massive surge and have had very few deaths. So I think we also need to look around and learn how an equity focus could be rolled out and what impact it might have even in the months ahead of us.
Let me explore that just a little bit more. Winston Churchill famously said, never waste a good crisis. And we've got a good crisis here. So how do we put that to our advantage to really nuts and bolts improve health equity?
Well, one of the things that I hope may be happening, and that many had hoped for at the beginning of this, when the shutdowns began, because these kind of disruptions have not been seen. I'm speaking to you from between Sierra Leone and Florida. I'm in Boston for a few more hours, and in all three of these places, you've seen these massive dislocations. They've been seen before in Sierra Leone recently, in fact, with Ebola, but they have not been seen in Boston or Miami in a century. And so the shock of that, I believe, led many, as happened with Ebola a few years ago in Sierra Leone, led many to ask, well, how are we going to, do we really want to build back to the way we are? Do we really want to be resilient and spring back into our previous shape? Or do we want to build back better and rethink, how does our healthcare system work? Is it really a healthcare system or an illness management system? How can we pay attention to those who are ill and injured and think more about preventing illness and injury? How do we extend coverage for these services, whatever they may be, good services, to everyone? So I do believe that's happening. And I think Churchill, he knew a lot about crises, but right now the COVID crisis is opening the room for discussion. This is a discussion, by the way, that Francis has led for many years, and the Vatican has been engaged in for often centuries, right? And popes have issued encyclicals about, what does it mean to take care of someone who's ill? What does it mean to provide assistance to the sick, the imprisoned, and on through the list? I think that is a very real opening in not just in the religious imagination, but in the, hardcore secular world of politics and business as well. So Max, you already know I'm an optimist, and I need to be for my work, but I believe we have to seize this crisis and really make some important changes to protect, humanity.
Absolutely. As someone else said, we've learned some lessons from this, but let's hope that we can make them stick and we don't forget what the lessons are. Dr. Paul Farmer, thank you so much for your time. And we hope that we will take these lessons to heart and not waste a good crisis. Thank you for being with us.
Thank you, Max.